Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then propylthiouracil. Propylthiouracil, the main side effect of propylthiouracil is it can cause hepatotoxicity, which is the most important side effect. So the main use is propylthiouracil is the drug of choice in thyroid storm. Why propylthiouracil? Actually, this has two actions. It will inhibit the thyroid peroxidase enzyme. Definitely, it will inhibit the thyroid peroxidase enzyme, and it will inhibit thyroid peroxidase, and it will also inhibit the uh, conversion of T4 to T3 conversion is also inhibited. So as a result, it is used in thyroid storm as the drug of choice. It is also the drug of choice for first trimester of pregnancy and also for lactation. Whereas drug of choice for second trimester of pregnancy and second and third trimester. Drug of choice for second and third trimester of pregnancy is actually methimazole, because propylthiouracil causes hepatotoxicity in infancy and in sorry, this the propylthiouracil causes hepatotoxicity in the pregnancy. So it is not used in pregnancy, but during first trimester, actually the first trimester methimazole cannot be used because methimazole can cause teratogenic effects like aplasia cutis and esophageal atresia. So during the first trimester and lactation, we use propylthiouracil.
thank you and thank you for watching.